Thanks everybody for coming. Um, this is obviously a continuation of our speaker series, and this month we have Dr. Katharina Maier from University of Winnipeg, and she's speaking on it's just such a different drug on police narratives of meth, crime, and punishment in a time of crisis. So Dr. Maier is an assistant professor in the Department of Criminal Justice at the University of Winnipeg. She completed her doctorate at the Center for Criminology and Socio-Legal Studies at University of Toronto. And she's interested in issues around punishment, penal governance, urban poverty, and social marginality. Social marginality and the relationship between criminal justice and public health. Katrina's research has been funded by the Vanier Canada Graduate Scholarship, SSHRC, and other funding sources, and her work has been published in Theoretical Criminology, Punishment and Society, and the Probation Journal, among other outlets. So Katrina, I'm gonna turn off my camera and I'm gonna turn it over to you.
Thank you so much. And I think I'm already sharing my screen, but if I'm not, someone please just tell me. So thank you to Dr. Butsarius and members of the Center for Criminological Research for the opportunity to be part of your speaker series. And thank you to Dr. Brizard for the coordination and technical support for this event. So I'm Katharina Maier. I work and live in Winnipeg, which is located within Treaty 1 territory and in the homeland of the Métis Nation. And for those listening who perhaps haven't been to Winnipeg, here's a photo of the Winnipeg River Trail looking west, where the Red River and the Assiniboine River meet. And it's one of my favorite places in Winnipeg when it's really cold and sunny and you can go skating and enjoy the outdoors. So thank you so much to everyone listening to this talk, and I'll just get started. So I moved to Winnipeg in 2018, July 2018, in the midst of what media, police, politicians, and healthcare professionals were calling Winnipeg's new meth crisis. So here's a story from the Winnipeg Sun published on December 26, 2018. 2018 in review, meth, violence, and a city in crisis. So this talk of crisis was not unique to this one story. Quite the opposite. In Winnipeg local news media from 2018, 49% of articles used crisis as an evaluative category to describe the meth situation in the city. Now, the framing of a drug issue as crisis, of course, is certainly not novel or unique to Winnipeg. Drugs and crime, as we know, are commonly framed by media as the latest epidemic, plague, or crisis. Still, the salience of crisis talk in this mid-sized prairie city at that time, I felt, was interesting because it provided a useful hook to, first of all, engage further with the concept of crisis itself, as well as investigate how street-level actors, so specifically police and public health workers, narrate their work, relationships, and normative and legal claims of responsibility at times of heightened concern around meth use in the city. So my talk today provides an overview of this ongoing project, of mine, which tracks the material conditions of the so-called meth crisis with a focus on how different actors and groups come to articulate this crisis. And so I'm doing this research in collaboration with my colleague, Dr. Bronwyn Dobshuk-Land at the University of Winnipeg, and with the assistance of a small group of research assistants. So I'll talk a little bit about what I'm going to do today. And I've listened to, I think, all or at least most of the talks of the CCR Speaker Series so far. And there's clearly quite a bit of thematic overlap between my work and previous presenters' work. So I'm thinking, for example, of Dan Jones' work on trauma-informed policing, but also Dr. Urbanik's presentation last month on policing in inner city communities in Toronto. So with this in mind, I thought that rather than presenting one coherent paper, perhaps it would be more generative to give an overview of the project as a whole and then highlight a few different findings from this larger project that we examine in greater depth in a number of papers, some are under preparation, another one forthcoming, and that I think connect to the work that members of the CCR are currently conducting. And so I'm highlighting some of these findings in the hope that we can engage in broader discussions around drug policy, urban poverty, and the role of police, which have always been pressing issues, but for reasons well known, are of particular relevance and acuity right now. And so, of course, I value your feedback and thoughts. And so with 4 minutes in, here's what's going to happen over the next half hour. So I will begin by talking a little bit more about this idea of crisis and what I think a crisis framework to understanding drugs and policing and public health has to offer. I will then talk a little bit about Winnipeg and the broader socioeconomic and political realities that shape how police and public health workers narrate their role and do their work in the context of dealing with meth use and people who use meth. I'll give you a sense of the different research components of this larger study, and I will then touch on two specific but interrelated aspects of the data. First, I will discuss how local news media have constructed the local meth crisis. And here I will make the point that while meth has consistently been framed as a crime issue, when it comes to the solutions that are being proposed to the so-called meth crisis, we have over time seen a greater recognition of public health solutions that are being proposed. This marks a cautious departure from earlier news stories about meth, as well as from existing literature which has focused on representations of meth in the US. I will bring these media representations in conversation or use them as a basis to then introduce you to a particular narrative that police used consistently in the interviews that I did with them regarding how they articulate their role in dealing with people who use meth. Here we'll show that police in the interviews attempted to make sense of their experience of confronting problems and populations that they can't effectively respond to. In other words, and how I will conclude, is that the so-called meth crisis is at least in part a crisis of the legitimacy of police, and therefore a critical moment for intervention for criminologists and others. At the end of the presentation, I will return to where I initially started, so this idea of crisis, to suggest that we recognize crisis as an important defining category in criminological studies that demands our critical attention as we navigate, first of all, the current global health pandemic, and also other deep-seated existing social crises. We obviously, Bronwyn and I, had to rethink the focus of our project quite a bit, because obviously we couldn't continue to study a meth crisis without taking into account the nature and consequences of the current global public health crisis and the effects this has had on meth and drug use in Winnipeg and elsewhere. Okay. So before I get into the idea of crisis, let me just say a few words about meth itself and also meth in Manitoba. So meth is also referred to as ice, glass, jib, rock, among a range of other names. It's a really powerful stimulant which affects the central nervous system. So essentially, meth releases dopamine in unnaturally high levels, so much higher than other things that may give us pleasure, like food, nicotine, sex, and so forth. Now, meth is often described as a very different or unique kind of drug, and that's for various reasons. First of all, it's comparatively cheap to buy, fairly easy to produce, and it can lead to a run or binge for several days that can be associated with intense emotional states and possibly hostile, unpredictable, and violent behavior. And so this description of meth as a very different kind of drug was something that was consistently highlighted in my conversations with police in Winnipeg. So I'll give you one quote here, which sort of goes back to the title of my talk. When Troy, a male in his 50s with over 20 years of experience, stated that, and I quote here, "This right now just impacts so many people and it's causing so much violence and crime, where again, if it was just opioids, people aren't fighting and hurting people. It's sad that they're losing their lives, but meth just drives violence and crime and aggressiveness, and it's resource heavy. Like, it's just such a different drug," end of quote. So researchers in the medical and public health community have written that meth is highly addictive, and it's also tied to a range of mental and physical health consequences, as well as behavioral changes, including increased wakefulness, increased appetite, sometimes also lack of appetite, as well as more serious potential health consequences like people suffering seizures and so forth. Now, meth, as we learned about in our research, looking back sort of the history of meth in Manitoba, is not a new kind of issue, even though in reading news articles, it may seem like it. In fact, in 2005, the Manitoba government readied itself for an impending increase in meth and introduced the Manitoba Meth Strategy. And so this strategy introduced a range of measures that first of all were geared at restricting the sale of key ingredients to use meth, and also implement a bunch of educational campaigns to educate the Manitoba public about the alleged dangers of meth. So the government reasoned this strategy by saying that other jurisdictions in North America have witnessed the sale and use of the street drug crystal meth grow to crisis proportion, and that Manitoba would soon experience a similar crisis situation. So this, however, did not fully materialize. In fact, in the early 2000s, and even like a little later, meth use remained relatively low and stable. It did not materialize or turn into a full-blown crisis until really a few years ago when meth use started to increase. And so I'll talk about that in a few minutes. Okay, when we look at existing research on meth and meth-related crime, we find that most of this research is focused on the US and more specifically rural America. And much of the research has examined meth and meth-related crime by looking at media portrayals of meth and its users against the conceptual framework of a moral panic. So I'm not going to say much about moral panic, as is probably well known. In the context of a moral panic, widespread and exaggerated public fears about drugs, crime, and social vice are stoked by the media and then subsequently mobilized by governments and other agents to chart new institutional responses, so specifically increased police power and capacity. Now, in these accounts, we find generally an emphasis on sort of an element of fabrication or exaggeration, so that there is or was no ground for a meth panic, or that the panic around meth stands in for panic about something else. Well, in Manitoba, there are a range of indicators that there has been an actual increase in the use of meth over the last few years. So I'll give you some numbers and some sort of examples here. The Winnipeg Regional Health Authority reports that in 2013, emergency departments across the city had an average of 15 meth-related visits per month. In 2018, it was an average of 207 visits per month. In 2016, the Winnipeg Police Service seized 11 kilograms of meth in the city. In 2018, it was nearly 27 kilograms. In a report published just a few months ago, researchers from the University of Manitoba reported a 700% increase of first documented meth use in the province between 2013 and 2018. So, looking at this situation, we were interested in moving beyond this framework of moral panic and engaging more seriously with this idea of crisis. So I would suggest that an examination of meth primarily or solely through the lens of moral panic misses opportunities to attend to the conditions that have led to the situation that is now called a meth crisis, and that has led to the level of stress and suffering that the increase in meth use seems to signal. To a significant degree, as I will come to a little later in the presentation, these are the same conditions under which police have come to occupy a central role in responding to people who use meth and other drugs. So let me say a little bit how we engage with crisis and what we think a crisis framework offers to understanding drugs, policing, and public health. Just going to check the time where I am. Okay, that's good. All right. So I'll start with what crisis means. So the etymology of crisis originates in the medical and legal fields of ancient Greece. So crisis was typically used in situations where a crucial judgment and decision was made regarding an illness or a trial. So when we think of the term crisis, we generally think then of high-stakes situations, of temporal rupture, or turning points that, in the words of Koselleck, would tip the scale. Or here we have Summerson Carr saying that crisis is something that projects urgency, fast, immediate action in the sense of do now, think later. So while this gives us a fairly general sense of what crisis is, namely an urgent situation, what constitutes a crisis in a specific situation remains unclear. Indeed, sort of going back to this news story that I started with, when we see this headline here, problem turned into a full-blown crisis, we may ask, at what point does a problem reach crisis levels? Or at what point does dysfunction signify crisis? In other words, what is the crisis threshold for researchers who want to study or describe it? So recognizing the inherent difficulties perhaps in defining crisis, scholars from a range of disciplines, anthropology specifically, have argued that rather than treating crisis as a fact or taking crisis for granted, instead we should focus on the meanings and effects of when crisis as a way of seeing and speaking of certain situations is invoked. So the work that I draw on in particular is that of Janet Reutemann, whose central contention is that crisis essentially functions as a narrative device that actors use to justify new interventions at times of exception. So again, rather than taking crisis for granted, Reutemann encourages us to consider when and how narratives of crisis emerge, the material conditions that underlie these crisis narratives, and to see how situations or problems essentially become diagnosed or labeled as crises. Because as we all know, not all problems reach the label of crisis. So to me, engaging further with this notion of crisis offers a good opportunity, as I said before, to both trace the material conditions of the so-called meth crisis in Winnipeg, as well as think about how crisis is invoked as a narrative device by different actors and organizations. So let me give you a sense of the different research components and what we've been doing so far, and I'll also touch a little bit on how COVID has changed the focus and timeline of this project. So the project consists of various components, a document analysis component, and interviews with different groups. So we've done a media analysis of local Winnipeg news media representations of meth, spanning the period from 2004 to the end of 2019. We've also done a policy tracing analysis of Manitoba legislative and Winnipeg City Council debates in the same time period to better contextualize, especially our interview findings, and get background information in how meth developed. In terms of interviews, I've done interviews with police in Winnipeg, specifically interviews with 30 officers employed by the Winnipeg Police Service. And as the next step, I will be doing interviews with paramedics and firefighters. So this part of the project was actually planned for last year in the spring and summer of 2020 for various obvious reasons, COVID and sort of the vital role of paramedics and firefighters in dealing with the public health crisis delayed the research. And so actually just this week, we received approval from the Winnipeg Fire and Paramedic Services to conduct interviews, and that recruitment is starting next week. So that is exciting. So we will learn more about the role of paramedicine and firefighters in dealing with meth and people who use meth. In addition to learning about how these groups within the criminal justice and public health field narrate their role in the context of the meth crisis, we were also interested in the experiences and perceptions of people who use meth themselves. So in late 2019, we were involved in conducting 3 focus groups with people who use drugs in collaboration with the Canadian Centre for Policy Alternatives, the Manitoba office. And we're then in the process of conducting one-on-one interviews, or not in the process, but in the planning stages of pursuing one-on-one interviews with people who use meth to gauge their experiences with the police and also the medical system. Again, because of COVID, this did not happen. And so we're now in the stages where we're hoping to do this aspect of the research in the spring and summer, and also rethink some of the methodologies that we're applying in our research engagement with people who use drugs. For us, it was particularly important that this is a community-based project, and especially in engaging with people who used to have a peer-led interview methodology, which again has not been feasible over the last few months or really the last year. Okay, I'm going to say just a few words about Winnipeg, and then I will jump into the data to present my findings. So at the time when meth reached a fever pitch, you could say Manitoba was 3 years into a conservative government that has had some drastic cuts to frontline health and social services. So a range of welfare benefits have been cut, especially benefits not tied to recipients' commitment to work for measures. Rental subsidies for low-income earners have been reduced, and generally funding to community-based organizations in inner-city neighborhoods, which, as we have written in other works, often act as mediators between social services and poor people, have been lowered. Before the Conservative government came to power, the NDP held power for 20 years in the province. And so while they maintained fairly steady investments in health and social services, they pursued unprecedented growth of the penal state. So for example, from the years 2000 to 2014, the prisoner population in Manitoba increased by 113%, with the most significant growth occurring between the years 2005 and 2014. As is well known, Manitoba's incarceration rate is one of the highest among the provinces, and this also includes the youth imprisonment rate. The Winnipeg Police Service currently, whose budget has steadily increased over the past 10 years, makes up roughly 30% of Winnipeg's city spending. So it is within this kind of broader political and socioeconomic context, namely a decline in health and welfare infrastructure, coupled with increases in carceral capacities, that we look at the meth situation and that police frame and respond to the problem of meth use and meth-related crime in Winnipeg. Okay, so I will start by saying around 5 minutes a little bit about the media work that we've done, essentially as a backdrop to then getting a little bit into the police narratives of crisis and dealing with people who use drugs. So as I said, our search period for the for the media analysis covered the period of January 1st, 2004 to December 31st, 2019. We did this to explore the development of meth starting shortly before the introduction of the Manitoba meth strategy. In total, we analyzed 696 articles published in this period across 3 major local news outlets, namely the Winnipeg Free Press, Winnipeg Sun, and CBC Manitoba. So I'm just putting this up here because you can see quite nicely this steep increase in media attention paid to meth starting 2017 and then really going up in 2018, 2019. In looking at how media presented or framed meth, or how we believe the article wanted the reader to think about meth, we found that 67%, so 463 articles, framed meth as an issue of crime. So in this group, meth was discussed, for example, as the driver of violent crime, property crime, transit threats, and violence and disorder more generally. What you can also see here in this graph is that the framing of meth as an issue of crime and with that associated danger, violence, risk, and so forth has been fairly consistent throughout the 2004 to 2019, with public health framings being really not very common. So in total, only in 194 stories, so that's 28%, meth was framed as a public health issue. The predominance of news stories that represent meth and meth use in terms of crime is significant and for us problematic because it neglects the complex and intersecting forms of marginalization that make people not only more vulnerable to the effects of meth and drug use more generally, but also places them at increased risk of police contact. In other words, the framing of meth as a crime contributes to and exacerbates the long-standing and extremely harmful criminalization of people who use drugs, as has been reported by others and elsewhere. Now, in addition to looking at how news media framed meth, we were also interested in the kinds of solutions that were being proposed in response to the meth issue in Winnipeg. So I'll proceed with that. And here I just have sort of 2 examples from the Winnipeg Press and Winnipeg Sun, which speaks to this framing of meth as a crime issue, focusing on meth as the driver of violent and property crime in the province. So in terms of solutions that were being proposed in news media, we found, interestingly, that while the framing of meth focuses on crime, what was proposed as a solution was much less consistent and actually over the years seemed to trend more toward public health and treatment solutions. So I'm going to put this up here and where you can see, it might be a little bit hard to see, the pinkish are the criminal justice solutions, then the public health solutions, and sort of that's what I'll focus on, which we found interesting because there seems to be an increase in greater recognition of public health solutions that came to the fore in these later media news articles on meth. So kind of going up in 2015, 2018, 2019, where public health solutions were actually proposed more frequently in media accounts of meth compared to criminal justice solutions. So these public health solutions include a range of things like harm reduction initiatives, safe injection sites, more accessible and more affordable treatment options, with law enforcement officials often stating that they can't arrest their way out of the problem, that they alone can't be responsible for the crime, for the meth problem, and that really it is a community response. And this is really nicely encapsulated here in one of Denny Smyth's quotes that for us now it really becomes a community response. The treatment is the key to this, intervention is key. It's not about arresting people. So we find a context here where meth is framed as a crime problem. However, the solutions that are being proposed seem to trend more toward public health solutions. So with this in mind, I want to spend around another 5 minutes talking about how police in this context articulated their particular role. So police, very similar to the media representations of meth that we saw in these roughly 700 articles, also frequently drew links between meth, crime, violence, and disorder. But just like in these media representations, acknowledge the challenges and outer limitations of the role of police in dealing with people who use drugs. Specifically, many interviews that I conducted talked about the role of police as this sort of glorified transport team. So this is an interviewer here, WJ, who said, essentially, we're a glorified transport team that apprehends them, so people who use drugs, and either brings them to jail or to medical facility. But during our time in dealing with them, there's literally nothing we can say or do. So by invoking this language of being a glorified transport team, we already see a sort of acknowledgement of the limitations of law enforcement and punitive responses in responding to the meth situation in Winnipeg. As WJ, one of the interviews said, quote, "The police's impact most of the time won't have any lasting effects. It's almost like just fast food where we're quickly dealing with this person." Now, interviews' narratives suggest that the ability of the police to operate as this, quote, transport wagon in the context of meth use has become increasingly difficult in Winnipeg over time. So I'll talk a little bit about Sam, one of the interviewees, white female, who at the time of the interview had been with the Winnipeg Police Service for 20 years in a variety of positions, both including general patrol and then more recently drug and gang-related investigations. And so I'll partially paraphrase and partially read directly from her narrative. Sam was saying that, "I think the reason it became such a crisis is, say we have someone who has ripped off his shirt, he's suffering paranoia and everything. We realize that person is on meth. Okay, so you can't treat his medical side because he's on meth. He hasn't committed a crime, but we can't just let him go because he's going to carry on doing what he's doing." Sam continued to say, "We try to take him to 75 Martha, the drunk tank, or the detoxification central. They all of a sudden had a policy, we don't take people on meth. Police then take him to the hospital, and the hospital says, well, you can't leave him because he's too violent. Now," Sam continues to say, "you have 2 police officers that are tied with a person who has to detox for how many hours it takes to detox. That car is now taken off the road for maybe potentially 7 hours dealing with this person who's on meth." And she ends her narrative by saying, "It just, I think, became a crisis. Like, what do we do with them? Where do we take these people?" So interviews similar to what we see in media coming to the fore said that they can't police their way out of this crisis, but that there's no structure in place for alternative responses. This interview said there's no step down or facility where they could stay for a while. So from the police perspective, what Sam describes presents a form of what I would call operational failure. The feeling that is expressed here by police interviewees is one of being on a conveyor belt in some sense, with no way to get off. So police recognize that they can't arrest their way out of this crisis, that other solutions are needed. At the same time, they're dealing with an overburdened healthcare system that provides little relief, and other forms of help and treatment are scarce as well. What Sam describes as the drunk tank, in Winnipeg officially termed protective care, so the drunk tank is a very derogative way of talking about protective care, is no longer accepting people who have meth in their system. What Sam's narrative shows is that police rely on other institutions to provide spatial fixes, like a, quote, drunk tank, that police use to manage and police drug-using bodies. When other agencies that police were previously relying on for these spatial fixes start to deflect responsibility, the limitations of the police become particularly salient. So according to police themselves, this situation that they're currently dealing with in Winnipeg creates a lot of frustration. It creates a sense of helplessness and hopelessness and also low morale. And it provides them with a predicament because their role of a glorified transport team, which is already a description that signifies the fairly limited role of police in dealing with people who use drugs or find themselves in situations of crisis, becomes even more limited or essentially unworkable. What Sam then describes essentially are striking examples of surplus carceral capacity coupled with a severely under-resourced health and social welfare infrastructure that police are now navigating and trying to articulate their role and work within. So how do we make sense of this or sort of tie this together? So I would go back to saying that when we think of crisis, we should acknowledge that crises are highly charged opportunities for shift in discourse and the status quo. The support for treatment and harm reduction that we sort of see in these media accounts of meth over time, I think, are noteworthy because in my view, they present a departure, first of all, from earlier responses that were being proposed in news media on meth in Winnipeg, but also a departure from existing previous research on meth focused on the US. The response that are being proposed focused on public health are also noteworthy because these particular drug users, people who use meth, tend to be framed generally as risky, dangerous, prone to violence, and a burden on the city. So perhaps you wouldn't expect a focus on public health and social welfare solutions to come to the fore in news media representations. Notably, however, despite the proliferation of public health as a proposed solution to the meth crisis, there has yet to be a more fundamental reframing or rethinking of drug use, which continues to be framed as an issue of crime and criminality. So in an effort to change the discourse and change the framing, and also change responses to how people who use meth are currently dealt with, I would say a bunch of things need to happen that our analysis, both media and police, point to. First of all, in addition, and I would say that's positive, to hearing about different kinds of solutions outside the realm of criminal justice, we need to see a broader shift in how media talk about meth use and people who use meth, and more broadly, people who use drugs. In order to do this, it is vital that media rely more heavily on non-police sources in media reporting on drug use, who are more likely perhaps to advance a public health, social welfare-based framing of meth use. Indeed, police were cited as a source in 39% of all articles that we analyzed, and in 29% of articles, they appeared as the dominant source. By contrast, healthcare workers and public health professionals were cited as a source in only 10% of all articles. Similarly, community-based organizations and drug users were cited in a small number of news stories as well, 16% for community-based organizations and a 9% for people who use drugs. In addition to a broader shift in how we frame drug use, which I think could be improved by incorporating in news media representations other non-police sources, we also need to talk about a re-envisioning of community safety to change the ways that meth use and people who use meth can be responded to in Winnipeg and elsewhere. When we look at these police narratives and think about crisis, what I would argue is that crisis shows here the outer limits, or what we have called the unworkability of the police role that is laid bare during this moment of crisis. What needs to happen then is a more radical rethinking of how we produce community safety and well-being for all, and affirm or invest in life-affirming measures and resources. This includes a greater investment in social welfare and public health solutions. So to end, I would sort of like to reflect for a couple of minutes then just on this idea of crisis as opportunity. So Jordan Camp has noted that the purpose of describing crisis moments and understanding them in all their specificity is to develop the skills required to intervene in them. So in addition to presenting opportunities for clarity about the way things work or don't work, crises, I would argue, are critical moments for articulating our normative views as criminologists about the state and role of the penal system, police, and so forth in society, and provides opportunities for pushing for change based on those articulations. And that is because, as Reutemann explains, crisis references a norm, so it naturally implies a comparative state of judgment. In other words, the willingness to name something a crisis reveals what is acceptable as normal to those doing the naming. So I would argue that, to wrap up, in invoking crisis, we as criminologists need to think about why we're using the word crisis when we talk about things such as meth crisis, the opiate crisis, health crisis, to recognize or to think about what a non-crisis state would look like, what for us would be an acceptable problem compared to a crisis situation. And as we invoke crisis, to also recognize that our studies of social phenomena like drug use and policing are always socially positioned, and to push us to align our research on these important issues with broader struggles and projects committed to social change and life-affirming measures and systems. So I'll end here. Thank you so much for listening, and I really look forward to your comments and questions, and we're right at 40 minutes, so thank you so much.
All right, thanks so much, Katharina. Sorry, I got an email in the middle of your presentation saying I'd mispronounced your name when I introduced you, so I apologize for that. Okay, so yeah, we can open the floor up to questions, and you can submit them in the chat if you prefer, both on YouTube. We've got 15 or so on YouTube, and then a few people here, or just turn on your microphone and if you're in the Zoom with us, turn on your microphone and ask your questions, and Dr. Maier will be happy to answer, I'm sure.
I can make this start if you want me to, then you can collect the YouTube questions. Do you want me to start?
Yeah, go for it.
Okay, sorry, I have kids in the background. So anyhow, Katharina, I loved your talk. Thank you so much. I thought it was really, really interesting. When you talked about the implications, one of the aspects that I really liked was when you started talking about the organization, what you framed as organizational failures, right? Like, so police officers are tied to these people. They don't know where to go there. They don't know where to go with them because other organizations may not necessarily be able to take people in. So when you talked about implications, you didn't really address that. If you had a magic wand, and I know we all wish to have a magic wand, what would you say to that? Like, I mean, because I'm interested in your opinion, because that's something we come across all the time too in our research. So I'm interested how you would think about that issue.
Yeah, that's a great question. I think there's a range of things to consider here. So what I heard in some of the interviews is that communication is a key piece that needs to be improved. So just to bring all these different actors that clearly work with one another, right, in their daily work, and that both intervene in the lives of people who use drugs actually at the same table and to talk about the issue at hand. I think that is missing. But in addition to communication, I think what we need is a real intersectoral approach to drug use. And that, you know, where the hospitals have a place, places like protective care units, paramedicine, community-based organizations that provide other kinds of services to people who use drugs. So a true intersectoral approach, I think, really needs to move beyond looking at these organizations more in silos. And I think that's something I commonly heard, that these organizations still operate in silos, even though, I mean, in reality, there's a lot of interaction going on. But I think to have a true intersectoral approach, there needs to be more communication, and also figuring out how responsibility should be distributed in ways that ensures that people who find themselves in situations of crisis on the street are provided with dignified support without fearing criminalization. Thank you.
Okay, I've got a question from YouTube here, from L'Oreal, and she says, thank you for your presentation, Dr. Maier. Can you speak to any differences related to narratives of meth use as a crime issue or public health issue based on the type of media analyzed? i.e., were there differences between narratives of meth as a crime issue or public health issue in more leftist, centrist, rightist, or alternative media outlets?
That's a great question. So there were some differences. So again, we looked at CBC Manitoba, the Sun, and the Free Press. Of all three, CBC, and perhaps it's not surprising, had the greatest focus on public health, and also included, you know, a range of other voices. In terms of meth as a crime issue, especially in the early years, we find the Winnipeg Free Press talk a lot about meth and crime, where we see a more heavy focus on issues such as meth labs, the risks of meth, the dangers that are, you know, that happen when people cook meth in their homes and so forth. So we do see a bit of a difference. The Sun had quite a heavy focus on meth and crime, but I wouldn't say it's black or white. We actually see across all three news articles both like framings of crime, some consideration of public health, and also articles that draw on both by proposing both a more crime-focused and public health-focused solution. So I would say yes or no, yes and no. There's definitely some variation, but not something like, you know, the Sun was exclusively focused on crime versus, you know, CBC favoring, you know, primarily a public health narrative. Thanks for the question.
Should I step in?
Yeah, go ahead, Kevin. Sorry, my computer was freaking out and I couldn't turn my microphone.
I wasn't sure if we were going back to the YouTube or not. So thanks for that. I mean, as Sandra said, some very familiar kind of themes with things we've heard here. I have just a very pragmatic question, maybe theoretical question. The pragmatic question is, why was it that they weren't holding people anymore in the, what was the phrase? The holding cells. I mean, what was the rationale for that? And I guess the theoretical question is, I'm wondering what you're doing here in terms of sort of particularly the media analysis. Is it kind of latently or explicitly, you know, you distance yourself from moral panics, but is it latently or explicitly like that social problems approach? The Kitsusi, Joel Best, Valerie Jeunesse, Gus Field. I mean, is that what the approach that you're taking here?
Yeah, so I'll start with your with the first question. So I think you were referring to it's called 75 Martha in Winnipeg. So it's sort of a yeah, where people who are intoxicated or have drugs in their system maybe taken by police or paramedics for the night. And so from what I've heard, my understanding is that 75 Martha said that they can't safely deal with people who have meth in their system. So it kind of goes back to very explicitly associating with meth use with violence, or the potential for violence, for danger, for presenting a risk to people who work in these kinds of institutions. And so, yeah, the decision was made, in my understanding, with reference to safety concerns.
Right.
And so, interestingly, I should say the research or aspects of the research were done in the midst of the provincial election, where obviously meth was one of the biggest issue. And so one solution that was being proposed by more conservative voices and also, by police, and that I talked about with police in the interviews, was sort of this idea of a facility specifically for people who use meth.
Right.
To deal with this issue that I touched on in the interviews, that police are kind of, you're sort of envisioning like driving around and just like, what do we do? So one of the solutions that they proposed is, well, we need a facility, or in other words, I would say like a spatial fix for people specifically who use meth. What we're doing with the media analysis, interestingly, when I started the media analysis, I was primarily just interested in learning more about meth and how it was constructed, and just learning generally about the discourse. So initially in the project, I actually hadn't planned to do a lot with the media analysis, and that sort of changed because of COVID, because obviously other aspects of the research were delayed. So we dug a little deeper into the analysis and are working on a range of different things. So my primary interest with media remains on this idea of crisis, and how media frame crisis, and when sort of the language and discourse changed from a problem to crisis. And so in this context, we also started looking at the difference, for example, between epidemic and crisis, and whether, crisis narratives emerge more frequently when meth is framed as a crime issue versus a public health issue, and so forth. So I don't know if there's like one way. There's sort of like a range of different things that I find quite interesting about the media analysis, in terms of like a general framing, agenda setting, and construction of this particular problem, but then also going back with a particular focus to learning about how this particular crisis narrative emerged and what this tells us.
Great, thanks.
So far we just have the one question on YouTube that I already read. So if anybody else in the in the Zoom wants to ask a question, otherwise, we are really close to time here. We got about 6 minutes, so we probably have time for just one more question, and then we should close things off. So
Jeff, I think the YouTube doesn't properly work, because I know that Marta has been in touch with me. There have been questions that may not be translating. So I will just be reading Marta's question.
Okay, yeah, I can only see her comment saying, thank you for the talk, and I don't see the other one.
Yeah, so she says, great talk, Katharina. Why do you think there's been such a notable shift in proposing public health solutions to meth in recent years? Is this driven by police narratives not being able to arrest their way out, and or based on growing understanding of drug use and crime as a public health issue more broadly because of harm reduction activist efforts, or something else altogether?
Well, I would say Marta sort of gave the answer to the question, because I think it's all of it. I mean, I think there's more and more an increasing understanding of all kinds of groups, I would say police included, that arresting your way out of a social problem does not work. And I think that understanding has, if it hasn't been clear before, it's certainly become clear in recent years for like a lot of different, things that happened here in Canada and elsewhere. I think it's also, I think it's partially like that general understanding, including sort of the way police have started to talk about their own role and acknowledge that things are community problems. So I'm thinking, for example, about the recent pilot project that has been talked about in Toronto with non-civilians being dispatched to crisis calls. Obviously, there's a shift in discourse and also more of an openness, right, to integrate these sorts of more public health approaches rather than focus or stay focused just on more punitive approaches. I also think it is the work of harm reduction communities, community-based organizations, other networks that have pushed these narratives and have tried really hard to reduce stigma and to ensure an understanding of drug use that favors a public health approach. So I think it's a range of things. I don't think it's one thing at all.
I see Justin has his hand up. Go ahead, Justin.
Yeah, I just had a quick question since it's about narratives, and I'm just interested in maybe how popular media representations of meth have affected how your participants in the media understand it, such as like, Breaking Bad is a very, maybe not anymore, but historically very popular TV show, stuff like that. Because there's a lot of stereotypes about what meth is and how it affects people and how the drug industry works. So I'm just wondering if there's any like popular media effects of how people understand meth from your findings.
No, actually, no. I mean, obviously, you mentioned Breaking Bad, and when we look at media representations of meth in the U.S. literature, especially from the early 2000s, there's this really heavy focus on the alleged physical health effects on meth and what meth does to people's teeth and people's face and these sorts of things, and projects like Your Face on Meth, those kinds of things. No, like nothing like that. So I haven't heard anything like that. We were interested, in talking to police, and I think it'll actually have a more prominent role in our interviews with paramedics and firefighters, how they related or how they thought about media representations of meth generally, and whether they thought that their own work and role was adequately represented in news media representations of meth. So this is something we've discussed and have looked at, but no focus on sort of these like popular representations of meth that surely have played a large role. And I would also say that I think there's been this sort of like imagery, again thinking about the US literature, of meth as this sort of rural drug and quote like white trash drug. And so the study in Winnipeg that we're doing obviously puts the study of meth into a very different kind of urban context.
Great, thanks so much, and thanks for the great talk.
Yeah, thanks, Justin.
So we're very close to time. Katharina, I have a couple new questions that came up on YouTube. Do you want to take them, or
sure? Yeah.
To run?
Yeah.
Okay, so I've got one from Yash, and he's asking, what are the emotional challenges one faces while researching drug use?
That's a good question. I think for me, it's been, my main focus has been on ensuring that this project is community engaged and community based, and then sort of understanding where I come from and how I position myself in conducting this project. So we've tried, hard to engage with different communities, to learn from different communities, to include them in the design of the project from very early on, and to engage them in the research process in different ways. So obviously you hear different stories, you see things like in the city. And I would say that yeah, like it's hard seeing that in Winnipeg. It was also interesting sort of moving here and taking note of the particular, social problems that we see in the city. But I'm also, very cognizant of the fact that how I am, socially positioned and situated and, shielded from many of the, harms and forms of marginalization and resulting vulnerabilities that the people who are, subject of this study and that are being, governed in this time of crisis are subjected to.
Okay, excellent. And well, this will be the last one from Brad. Are there reasons for meth use in Manitoba that are unique to the region?
The reason for meth use, if they are unique to Manitoba, I don't know if I can answer this. I mean, meth use, so there's different reasons that I have heard why meth has become this, I'll just call it kind of like drug of choice in Winnipeg. And, the main reason that we've heard is sort of the price of meth, so that it's, very cheap. And I think what also, I kind of talked about the health effects and behavioral effects of meth. I think what we shouldn't forget is that, meth has particular, I don't want to say perhaps benefits, but, in a city where it's minus 30 degrees and, very cold and people might be struggling with housing, a drug, that, can allows you to like stay awake for longer periods, that can potentially help deal with hunger, that generally increases people's agility, that kind of like keeps you moving. I think that's something to explore further, whether the particular reasons for using this are sort of tied to perhaps the particular realities of Winnipeg. And I think that would be interesting.
Okay, wonderful. Well, thank you so much for the presentation and for answering all of those questions.
Yeah.
That'll bring our talk today to an end. So we will be back next month on the last Friday of the month again with Nicole Myers, I believe. And I don't have a topic from her yet, but I will have advertising out, very soon once she sends me the title of her talk. So I'm going to shut the live stream off. Anyone who's in the Zoom, feel free to stick around and chat with Katharina for as long as she can stay, and we'll see you in a month for the next.